Utah medical workers back from treating COVID-19 patients in New York stress the importance of social distancing here at home.
Fox 13's Haley Higgins is live at Intermountain Medical Center in Murray. Haley, I bet you they have some incredible stories to share with everyone.
Yeah, one nurse told me that no one could have really been prepared for the amount of death that she saw in New York, and she still worries, though, something similar could happen here in Utah.
The gravity of it was severe, and I realized this is what a pandemic looks like.
Whitney Hilton is one of 100 caregivers who spent 2 weeks relieving the exhausted medical staff in America's hardest hit state.
Going out there, you hear it's bad, but when I actually walked in the hospital and I saw these critically ill patients, all sicker patients I've ever seen in my life, to be honest with you, for the most part, all just lined up next to each other.
She and others saw patients dying alone with family unable to visit. She says it was the most shocking and humbling experience during 7 years of nursing.
I, would come home at night and all I could really say was to my family and to my friends, if you could see what I see, you would do anything and humanly possible to prevent it.
That was echoed by many skilled physicians, nurses, and respiratory therapists who deployed through Intermountain.
I saw it in a community not much different than here. This disease can spread like wildfire, so let's respect it.
Utah itself changed while they were away. Restrictions lifted, the economy opening up, some saying it's happening too slowly. State lawmaker and Utah COVID-19 Community Task Force member Paul Ray argues, quote, government needs to admit that it overreacted and completely reopen Utah. That's dangerous thinking, according to medical staff.
I see communities and we see some groups who are moving too quickly, and I think in a few weeks, sadly, we are going to see the consequences of that.
These caregivers say they're thankful for the opportunity to serve in New York. They also say they'll never forget what they saw.
It didn't really spare a certain age or ethnicity or, anything like that. And so I think that was one thing I took home was it literally could get anywhere.
Now, the physicians I spoke with say that they're going to take a lot from what they learned in New York and implement it here in Utah. Reporting live in Murray, Haley Higgins, Fox 13 News, Utah.